Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Alif Daniel Benjamin Hasmadi. I'm from SR134B. So for today's presentation, I will present about CPR and bandaging technique. So firstly, I will explain about CPR. So CPR stands for cardiopulmonary resuscitation. It is an emergency life-saving procedure that is done when someone breathing or heartbeat has stopped. This may happen after an electric shock, heart attack, or drowning. CPRs combine rescue breathing and chest compression. The purpose of CPR is to keep oxygen flowing in and out of the lung, and to keep oxygenated blood flowing through the body. It can help to delay tissues from death. Firstly, before giving CPR, check the scene and the person. Check to make sure the scene is safe. Tap the person on the shoulder to see if they are okay. And look for signs of rhythmic and also their breathing. Second, call 911 for assistance. If there are no response from the victim when asked if he is okay, call 911 or ask a bystander to call for help. Third one is begin compression. If the person is unresponsive, perform hands-only CPR. Place the heel of one hand on the center of the chest. Third one, place the heel of other hand on top of the first hand. Then lace your fingers together. Fourth one, position your body so that your shoulders are directly over your hand, and keep your arms straight. Fifth, push hard and push fast. Last one, keep pushing. Continue hands-only CPR until the emergency service comes. So, the disadvantage if you do the CPR incorrectly: if the victim is seriously ill or has a couple of illnesses, CPR may not be able to restart your heart. Shortness, broken ribs, lung collapse are all adverse effects of CPR even after the victim survives. We will continue to bandaging technique. So, today I will do the bandaging technique for wrist sprain. So, a wrist sprain occurs when the strong ligaments that support the wrist stretch beyond their limits or tear. This occurs when the wrist is bent or twist forcefully, such as caused by a fall onto an outstretched hand. Wrist sprain are common injuries. So why we need to do the bandaging? So it is advisable to wrap it as soon as possible. This stabilizes the joint and facilitated recovery. Wrapping is also one of the most effective remedies for carpal tuning pain, as well as inflammation and other hand-related injuries. So, for the equipment for the bandaging technique, it required bandage and also safety pin for bandage. If you injured your wrist in a fall or accident, you may need to wrap it to help with the swelling and to speed up healing. A minor wrist sprain can often be treated with compression wrapping, but if you have a severe pain in your wrist, seek medical attention. Here are the steps for wrapping your wrist. First one, wrap the bandage around your wrist once, starting at the pinky side of your hand and with your hand facing down. Second one, pull the bandage to your thumb side and wrap around your palm once. Third one, cross the bandage back down to your wrist and wrap again around the wrist. Fourth one, reverse your wrap to the pinky side of the hand and around the palm. Fifth, wrap around the wrist again. And lastly, use the rest of the wrap to stabilize the wrist. Make sure that you don't wrap your wrist too tightly. If your fingers begins to tingle or go numb, you should remove the bandage every wrap. that's all from me. I hope you learned something from this video, and thank you and Assalamualaikum.